Okay. Well, welcome, and we want to thank you for watching our film Blue Eye Shadow, starring Lamont Young. And we wanted to have a conversation after the film to just talk about a brief window into the story. And we have an esteemed panel of guests. As you know, Blue Eye Shadow was a story of me and my brother, and Lamont Young was able to help bring it to life. And we have a very distinguished guest who is joining us today to help us put some context behind HIV and AIDS today, particularly as it's, we're currently in a second pandemic. So our national presenting partner, I want to introduce C. Virginia Fields. She is the president and executive director of the National Black Leadership Commission on Health, Incorporated, also known as Black Health. And again, our dynamic and talented brother, Lamont Young, star of Blue Eye Shadow, one of the producers of Blue Eye Shadow, and one of the gentlemen who really brought this piece to life. And I'm forever grateful for him for that. So welcome, and let's have this conversation regarding Blue Eye Shadow and put it in some context. So Virginia, I want to start with you. You have the full scope of HIV and AIDS and the impact it's had on African-American communities and people of color. And you have the benefit of time where you've seen it from the origins through now. Can you share some of your reflections on HIV and AIDS then and also as it relates to the communities now?
Well, first of all, let me thank you, Eddrick, for even making this possible in terms of telling your story, a very powerful story, and to the partners who joined here, Lamont. And I think that, viewing the video was very impactful, I must admit. Not only did it bring to mind a time when everything was like carefree, summer, vacations, family, church picnics, out of school, very little to worry about. But when I looked at it also in terms of the timing of it, little did we know that AIDS and HIV was raging and ravaging so many of our family members, our friends, and our colleagues. So as I viewed it and reflected on those times, good times, not so good times, the fact that you actually experienced your brother through his wearing of Blue Eye Shadow and keeping that as a secret in such a young age had to be very difficult. Actually, I think you said that at one point it changed your perspective, but obviously it did not change your relationship. And I thought about the number of people I knew in the early days of this pandemic actually, who were still living in the shadow of darkness, not even acknowledging that not only obviously that they were living with HIV, but also not willing and openly living their lives as gay men. I thought about a particular friend of mine who died within the early stages of this. And he was a community leader, community activist. Everybody knew him. And what we realized he was doing was going from one hospital out of the community to other communities. I lived here in Manhattan, in Harlem. He was going to hospitals in lower Manhattan just to keep, people from knowing this. But he ended up coming back and unfortunately, or rather fortunately, dying at Harlem Hospital, where many people knew him, and I had the chance to visit him before his passing. So all of that came to mind. But moving forward to the here and now, unfortunately, we're still seeing so many people, men and women, who are living with HIV/AIDS, and they're not coming out for fear of being ostracized, for fear of being denied opportunities, for fear of their families turning their backs on them. And we're still seeing that today, despite gains that I'm sure we'll talk about that have been made as far as antiretroviral treatments, prevention, etc. So then and now, unfortunately, HIV/AIDS is still disproportionately impacting African Americans more than any other group, young Black men, transgender people, and heterosexual Black women. So we still have a lot to do, along with the achievements that have been made.
Thank you for sharing that perspective. Lamont, let me ask you now. You know, you've had the, I've had the pleasure of seeing your work, not just doing this piece on film, but you actually had a chance to perform this piece on stage originally, and you brought some emotional components and you brought the story out and you made it live. I mean, you really bring that to the piece. How have you been able to take your own experience with, you know, members or possibly family members or people, you know, especially in the acting community, folks who have dealt with HIV and AIDS and the devastation it's had, and how are you able to take some of that and interpret it into this role?
Well, first of all, for me, man, as far as having a direct interaction with someone that, or people that I'm related to, or people that I interact with where AIDS has affected them, I haven't had that. But what I have had is an interaction with those that have dealt with other health disparities, right, within our community, because, you know, we sit at the top of all health disparities when it comes when it comes to us as a people, you know, and it's egregious when you look at the expanse when it comes between us and the next groups, right? So I just looked at it from one of those kind of perspectives, knowing that I have family members that have diabetes, that have, you know, cancer, that have heart disease, and all these other, you know, blights on our community that kind of really aren't really dealt with. And what I did is I started saying, okay, well, what does it look like to look past somebody's situation and connect to who they are? And what does it mean to be family? And what does it mean to love someone past and through their pain and their struggles and their hurt, and how to connect there with them, and how to help guide them through whatever they're dealing with. And that's the perspective that I took, because for me, this was very much a story of love and commitment and about support, you know, and now for me, that ties back into the HIV things, because then going back with the then and now perspective that you get, going back then, there was a whole lot of hesitancy to be involved in people's lives that had HIV. You know, we stood back and we were like, I don't know about that. There was a lot of fear. But now, as you look at it, you see it as another blight in our community. We have to love people that are dealing with these things, because there are multiple things that are egregious when it comes to these health disparities, and AIDS is one of them. And we have to give that the exact same amount of love and attention and support for people in our community that are going through these type of things, going through this type of disease, just like we do for any other disease that is decimating our culture and community. You know, it still is something that's decimating our community, so we need to show the love and support. And for me, that's where I drew my emotionality from the fact that I hate to see us as a people being decimated by things that are going unchecked.
Very well said. And so now I'm going to turn it over to Virginia, because she's got some questions that she has and she wants to bring forth to this group. So Virginia.
Thank you so much, Eddrick. And as Lamont said, these are still trying times, and people are still being stigmatized. That is why they're not being tested, or they're not telling, and they are living their lives in total fear. So we still have a lot to do in that regard. And of course, Eddrick, for you, the story is personal. Having the dramatic story being told of your life in terms of how you learned about this, sitting quietly, not saying anything about it. And often we hear It's said that art imitates life, and obviously Blue Eyeshadow is a dramatic presentation of a true story, your life. So talk to us. How is it for you emotionally to have been able to tell this very personal story, and what aspects did you find most important to the story?
Oh, great question. I think any artist, whether it's a writer or actor, poet, there's always a sense of being vulnerable and being able to open yourself up for inspection and at the end of the day, judgment and criticism. But I think when you want to tell your truth, that's the guiding light. You would just have to tell your truth. After I wrote the story, which we published it in Melange Musings on Life from a Writer's Pen back in 2018, I had two stories already in the book, and this after I wrote Blue Eyeshadow, I was sitting there and I didn't know if I wanted to include it in the anthology because, to your point, it was so personal. And so I shared it with my wife, Melody, and she read it and said, no, you've got to tell this story because it's compelling. I shared it with some other close friends, shared it with my writers group, Writers Resource Center of Northern California. And that gave me the confidence and the courage to put it out there. What I wanted to convey was the relationship between two brothers. I think growing up with a big brother is something that's priceless. You can't get that type of relationship anywhere else. Telling the story of where we were, Parkchester Village, Richmond, California, which kind of had the both worlds of an urban environment, but we also had a very rural setting. I had a regional park. Literally, my backyard was a regional park. So having the plum country and the places you could go and get that fruit, as Lamont eloquently brought through in the piece, I thought that was important, given it a sense of place. And finally, it's my immediate family, and knowing that and not knowing how reactions would be, what would they feel about telling something so personal. And I think one of the most validating things to me was my parents, when we were telling them about the movie, and my parents are supportive and said, go for it and make it happen. Candidly, I don't know if they've read the story completely. It's very emotional to them, as you can imagine, and I'm not sure if the film is something that they're going to actually want to watch from just an entertainment perspective, obviously because it's so personal. But at the same time, as I said, having that validation of my cousins and the people who knew Eddie after reading the story, one of his best friends, a really good friend of mine named Gary, called me on the phone after he read it, and we cried together about the memory of Eddie. And so bringing all of that, I think, helped with the story. I think I don't think at the end of the day, it's probably not a unique story. I'm sure there are other families and young men and young brothers who have had this type of experience. So if it's a way to bring about that conversation, and at the end of the day, bring some awareness around HIV and AIDS that continues to this day, then I think we've done our job from an artistic standpoint.
May I just ask you one further question?
Sure.
And that is, did at any time you think about the fact that maybe the reason he showed you this part of his life, that he wanted you to say something to him or to the family to help him be able to move through this at an earlier age?
That's a great question. I don't know. And the thing about Eddie is Eddie was an extrovert. He, from the time I can remember until he was unable to do it anymore, Eddie was the life of the party. He was the fun brother. He had friends. He was really just an engaging person. I think having that type of relationship where he could show me that, side of him, I think helped him. It was still several years before he actually came out to the family and about being gay, and then ultimately, his passing in 1995. But Eddie was a remarkable guy, and as I try to portray, and I think Lamont was able to bring forth, that whole sense of what is a normal lifestyle. I mean, Eddie played football, Eddie ran track. Eddie took girls to the prom. Eddie was, was from the outside, he was as tough as any guy in the neighborhood. It's just that, when my mom and dad would go out to socialize and dance, he would, what's in the story that would come to life. So, yeah, I think Eddie would have appreciated at least, the telling of the story. And I think we did it tastefully and respectfully. And I'm proud of the way it turned out. And if that gives some attention to what kind of man Eddie was and what kind of person he was a great person, then I'm happy with that.
Great. Thank you so much for sharing. And of course, Lamont, your performance was both captivating and illuminating. And it certainly brought tears to my eyes as I watched it and heard about the story, and again, reflecting upon the past, especially personal friends and colleagues whom I have known to die from AIDS-related illnesses. So in the film, of course, you conveyed a family dynamic that those of us who are in healthcare and advocacy work, we still grapple with this on a daily basis, having tough decisions to be made with family members, recognizing that they're not always ready for the truth. And as I said before, that has stopped many of the people we work with from telling their story or living their lives fully. So can you share with us your approach to this character and the story of Blue Eye Shadow?
Oh, most definitely. Well, first of all, thank you wholeheartedly for your compliment. Yeah, I'm not really good at receiving them, but I'm humbling myself and saying thank you. I appreciate you very much, man, for that. Now, as far as my approach for the story, let me say it like this first. I have a godfather, or my only godfather. He's gay. So when I talked to him and I told him about this piece that I was doing, he got really, he told me something. He said, Lamont, let me tell you something, son. He said, the reason why I love you, because from day one up to this day, you never, ever stopped showing me that you love me. And so that's the approach that I took with this piece. This is a love story. This is a love story. Bottom line, the love of two brothers. So I anchored my heart and all my emotionality on that, and then just allowed the story itself to navigate me into what directions I needed to flow. From now, me personally, I always pray and I ask God to guide my interpretation of the piece that the writer has brought forth, because I believe that they have been inspired to bring the piece to life. So I want to make sure that my spirit is in alignment to what flowed, that their creative spirit, had when they put the piece, into play, or when they created the piece. And so for me, I connected to the love aspect, and I let every character trait and every nuance that you've seen in the film develop from that simple perspective that I loved my brother. And that's what formulated my character, and I'm praying and hoping to God that that's what came out and what was conveyed.
Well, it certainly captured my imagination and my spirit, and it certainly conveyed that. And I would say that collectively as leaders, as we watch this and as we continue our work, we see that not only storytelling, healthcare advocacy, a holistic community approach, we must internalize this as a modern day familiar story and be able to use it in order to continue our work that still needs to be done within the American community, African American community specifically, to see better outcomes. I think you mentioned earlier, Lamont, about how the disparities disproportionately affect African Americans. Here we are in the midst of another pandemic, COVID-19, and now we've got COVID-19 and we're still having to fight HIV, AIDS. So working together collectively and telling your story in the way that Blue Shadow has conveyed that I think really helps to make a difference. And in my work as President CEO of the National Black Leadership Commission on Health, we are out there daily trying to educate, mobilize, and empower communities to be able to work collectively. So storytelling is a very, very important part of that. So with that said, Eddrick, I'm going to turn it back over to you for the next segment, but I think it's coming through.
Yeah.
The value of this video and this film.
Thank you. And before I just get to the really next segment, I do want to take a moment and just, I want to thank Terrence Ivory, the director of this piece. Terrence is an amazing artist. He took the vision from the book to the stage and then also interpreted it for the film. And so I really want to give a shout out to Terrence Ivory and also my brother, Joe Guidry, my brother from another mother, Joseph Guidry Jr. out of Sacramento. The theme song for Blue Eye Shadow is amazing. We thought it was important to have an original composition for this piece. And I think he was able to capture that, the emotionality of what we were trying to convey. So again, kudos to Joe. So as we get ready to close, I think what we want to do maybe is just give some closing remarks about some final thoughts about the film. And then at the very end, right before we close, we'll give everybody information about how they can see it and also information about the various partners. And again, let me start with you, Virginia, just some of your closing thoughts and views, and what are some of the last things you want to say about this piece?
Again, as I said, I thought it was very, very captivating, and I'm very pleased to be a part of this presentation, especially during World AIDS Day. This is about, I think, the 37th year that we are commemorating World AIDS Day. That gives us an opportunity to not only reflect and appreciate the lives of those that have been lost to AIDS and AIDS related, but also to look at the achievements. And the achievements are great. We know that we now have much more research that has been done that has led the way to antiretroviral treatment, which is much more accessible to people globally, helping to reduce the virus. We certainly have more prevention tools, PrEP for persons who are at risk to be able to prevent themselves from becoming affected. So now that we're in the age or the stage of working to end the epidemic, my advice, and taking it from the film, I think that it could really help continue to move us, is that people should get tested, know their status, and if they are positive, to seek treatment and care, which is much more available than previously, and to use prevention method, PrEP, as a prevention tool in order to not, become infected. We know that there are many other factors that we have to continue to work on, as I said, reducing stigma, working on social determinants that impact our disproportionality of being infected, as poverty, education, lack of medical care. All of these factors, which again have been amplified more through COVID-19. So that's much work to do. And I think this video adds to the information or the opportunity to educate further. And I'm so happy that you guys produced this, and Lamont, you performed it. And I think it's gonna really do a lot to further educate and continue to raise awareness.
Thank you. And then I want to just thank you and your organization for being a national co-sponsor of this and helping us put the word out and really embracing it. And thank you for your collaboration with the project. So really appreciate that. Lamont, sir, closing comments?
Okay. Well, I just want to say that it was a blessing to be a part of this project, and to still be a part of helping, to promote the concept of collaborative efforts when it comes to dealing with the issue of AIDS. And I say collaborative because I go back to my statement, us as people, us as a community, we really haven't supported the HIV community within our culture because of the stigmas that are associated with it, right? Without knowing that it's not just a quote unquote gay disease. It translates across multiple demographics and within our community, you know. So I'm hoping that this piece will be something that will generate the dialogue that will stimulate empathy, because I think a lack of empathy is what stagnates the flow of resources in our community in order for collaborative efforts to be able to fill in the gaps in areas where we have what I call blights and plights in our community. I think the reason why we're disproportionately seen in all these different areas of health disparities, specifically as we're talking about with AIDS as it's concerned, is because the fact that we don't allow our empathy to push past the stereotypes in order to be able to let resources flow to support. And I'm talking about resources as far as counseling, consulting, and resources, as far as financial resources, as far as whatever it may be. Because what our piece showed is that AIDS doesn't just affect those that are infected. It affects the family, and through the family, it affects the community, and through the community, it affects our culture.
Well said, sir. Thank you. And right before,
yes,
please.
And I agree with Lamont, everything he said, empathy, but I must also add racism. The fact that African Americans continue to be disproportionately, we have not seen the level of resources coming into our communities, nor acknowledging it until, you know, we brought the fight now to those who make these decisions. But racism, when it was predominantly white gay men, we saw many more resources going into the communities. But as it has now become, and still is, predominantly Black, gay men, transgender, heterosexual Black women, the resources are not there as heavily as they were. So we got to continue to fight for those resources. Well
said. Amen to that. I'm just going to take a few seconds just to thank all of you for your participation today. Virginia, thank you for your organization, for helping us as a national co-sponsor. That's the National Black Leadership Commission on Health. You can go to nblch.org, nblch.org, and you can get all the information about this great organization and the work that they have done for years and continue to do in this fight against HIV and AIDS. I also want to thank August Varner Media, Sandra Varner, our executive producer, who is just amazing at bringing people together, Lamont and Powerhouse Inc. Productions, Terrence Ivory, the director, Alex Flanagan, our director of photography. We can't forget about Alex, Joe Guidry. There's just so many people that came together to make this happen in such a short time. And we want to thank the viewers, and we hope and invite you to continue this conversation. You know, the film is available. If you want to build your own discussion groups around the film, we are available. So we'll have some information available for you guys to connect with us. And if you want to continue to see the film and to register for it, you can go to See Blue Eye Shadow. That's SEE Blue Eye Shadow, one word, seeblueyeshadow.com. And you can information on how to register. You can see the behind the scenes footage, and you can also listen to that just amazing theme from Joe Guidry that he was able to compose. So again, thanks everybody. We want to continue this discussion. This is not the end. This is just the first step of having this dialogue. We hope everybody stays safe, and we hope everybody can reflect and continue to support those who are out there fighting the good fight to help us prevent the transmission of HIV and AIDS, particularly among people of color. So thank you, everybody. Stay safe, and we will talk to you guys again. Thank you very much.
Thank you.